Want to sleep like a pro? There's a reason 80% of NFL players choose Sleep Number smart beds. These game-changing beds automatically contour to your head, neck, and shoulders, delivering MVP-level comfort all night long. Perfect for post-workout recovery, you can adjust the firmness whenever you need, while the climate-cool technology keeps you up to 15 degrees cooler. Plus, it's like having a sleep coach. The bed learns your patterns and provides personalized insights for better sleep. Why choose a Sleep Number smart bed? So you can choose your ideal comfort on either side. The only bed that lets you make each side firmer or softer whenever you like. Your Sleep Number setting. And now, it's the Sleep Number 4th of July sale. Save over $600 on the Sleep Number P5 King Smart Bed, the lowest price of the season. Limited time, exclusively at a Sleep Number store near you. See store or sleepnumber.com for details.
So, Barry, a couple episodes ago, we announced this partnership that we're doing starting this year with this really great company, AEP Connections. And I see that we've added quite a few listeners since then. So do you want to give us a little bit of a refresher here, give our listeners a refresher on AEP Connections, who they are, and why we're partnering with them?
Yes, AEP Connections hosts live webinars. I've actually done some work with them, and it's always high-quality topics in neurodiversity. But they're building a library of on-demand courses now. And this summer, they're focusing on providing you with fantastic content at your fingertips. They have courses designed specifically for on-demand with many speakers on many important topics. However, many of their live presentations from this spring are also being made available for on-demand, so you can access them now. If you aren't able to see the courses live, be sure to check them out over the summer. Also, if you need approved provider hours, and it's really important for things such as licensure, they offer many, so be sure to check out the different courses and see the approvals from so many professional agencies.
Absolutely. I know, from Kristen's point of view, I always was hearing about, I'm as an SLP, I need more hours. I need more, professional development. And it's great. It's good to be on top of your craft in that way. So if anybody's looking for some discounts on professional development, AEP Connections, they actually have a few options. So they've got bundled packages, which will, save you money, but also by being a friend of Uniquely Human, the podcast, and AEP Connections, they are extending an additional discount code. So you can save an additional 10% on this offering just by entering the promo code UH10. That's UH10 in your checkout cart. Any topics that we should be aware of, Barry, that you're doing, for instance, that I should be signing up for?
Sure, yeah. And we're talking about Gestalt language processing. We talk about neurodiversity and issues related to that, but there are many other speakers as well. And it's a real cool perk that you get the 10% discount if you put UH10 or UH10 in your checkout cart. Check them out.
Awesome. The primary purpose of Uniquely Human, the podcast, is to educate and inform. The views expressed during all episodes are solely those of the individuals involved and do not constitute educational or medical advice. Listeners should consult with professionals familiar with each individual or family for specific guidance.
Uniquely Human, the podcast, is produced by Elevated Studio. Music is graciously provided by Matt Savage of Savage Records.
Hi, I'm Dr. Barry Prezant, clinical scholar, researcher, and consultant on autism and neurodiversity, and a Brooklyn boy raised in the big city.
And I'm Dave. I'm none of those things, and I grew up on a farm in Illinois. But being on the spectrum myself, I have plenty of personal insight to lend.
And this is Uniquely Human, the podcast, a show that illuminates and celebrates autism and neurodiversity. Today on Uniquely Human, the podcast, we are very excited to have Dr. Wendy Ross joining us. Wendy, welcome.
Thank you so much for having me.
It's absolutely our pleasure. So a little bit about Wendy, and then there'll be a number of topics that we'll talk about, especially in terms of providing appropriate medical services in medical settings for neurodivergent and autistic individuals. So Wendy is a clinical professor, a developmental pediatrician, and the inaugural director of Jefferson Health's Center for Autism and Neurodiversity. She graduated from Mount Sinai School of Medicine and completed pediatrics residency at Yale and developmental pediatrics fellowship at Harvard. Wow, pretty pedigree settings there. In her clinical practice, she works with children to clarify and support their development, integrating medical, educational, and therapeutic plans into a cohesive approach that is so sorely needed, yes. She supports neurodivergent individuals through the center, including those often with invisible challenges such as intellectual and developmental disabilities across the lifespan, even though you're a pediatrician, yes. Her work focuses on improving community belonging by advancing neurodivergent-friendly healthcare, design, and everyday experiences. She additionally has pioneered autism inclusion programs at museums and sporting events, in addition to other settings. Dr. Ross has also pioneered inclusive game day programs with all of the Philadelphia's major sports teams, along with initiatives that make air travel more accessible for neurodivergent individuals. In 2014, Wendy was recognized internationally as a top 10 CNN hero for her innovative efforts in supporting neurodivergent children, adults, and families. And I need to say that's one of my favorite shows towards the end of the year when we see those here. So congratulations on that, Wendy. That's incredible.
Yeah.
So let's talk about you, about your history, why you chose to go into medicine, and in particular, your focus on autism and neurodiversity.
Yeah, so it's sort of an unusual story, Barry. Actually, I was never a science-based learner or a math-based learner, and I was going to be a psychology major in college. And then as a freshman, there was an application process between my school and a few others and Mount Sinai where they were trying to get humanities majors to become medical students. And I wrote my essay about crayons and coloring and was accepted to that program as a freshman, the end of my freshman year in college. And I was obligated to actually not take really any science. So it wasn't just that I was a humanities major, but I was non-science bearing person. So, so I was really lucky to get into that program. It made biochemistry really hard when I got there because I had no prerequisites for it. But the other classes were okay. And I really feel lucky because I don't know that I would have ended up in medical school otherwise through a traditional route. So, and then I really always, once I got to medical school, I really liked playing with kids, to be honest. And so pediatrics seemed like a natural fit for somebody who wanted to be, around kids, probably a little more than adults. And then I was looking for an underserved program to work in, and my husband had gotten a job in Framingham outside of Boston. And I grew up kind of poor, and I wanted to sort of pay it forward. And I spoke to Judith Palfrey at Children's Boston, and she said, I don't know of a clinic like that, but we have a fellowship in advocacy and behavior and development. So I kind of again stumbled into it, and I really loved it because I got the unabridged stories instead of just the short stories. I mean, I still at that point was doing general peds, which is kind of fun too, but I got to hear people's stories and I got to play with kids in more depth and try to understand where their strengths were and where their challenges were and how we can leverage their strengths to help support their other areas of development. And so it was a little bit like being a detective, and I got to work with other professionals like occupational therapists, speech and language pathologists, educators. So that was super fun, and I got really lucky.
I don't know many physicians who say they go into medicine because they like to play with kids. That's wonderful. Exactly. So we have some connections. I'll just throw them out here that I didn't realize. My son was involved in doing research at Mount Sinai during the COVID years. And since that time, he's actually now fourth year medical student and probably will go into pediatrics. He's down at Duke, finishing up down there. And it's just amazing also Boston Children's. My wife, for many, many years, worked at Boston Children's. So it's all of these paths cross. So let's talk about some of the, especially the innovations that you've incorporated into the work at Jefferson Medical Center and the development of the Center for Autism and Neurodiversity, because we do know one of the greatest challenges for families and for neurodivergent people is when they need medical care going into a medical center or a hospital setting. But you've really integrated some amazing innovations that are ongoing right now.
Oh, thank you. Yeah, I mean, again, I got kind of lucky with the opportunities that I have been able to take advantage of. When I moved back to the Philadelphia area, initially I was in an underserved hospital in North Philadelphia, and what I was realizing was that my patients, my families with kids with autism weren't going out because they had a kid that appeared typical, but then didn't behave typically. And then people look at you like you're a bad parent, you know?
Mm-hmm.
And these families, you know, it was before they even got someplace because you got to get on a bus or SEPTA, you know. So I really couldn't, like, it just upset me so much. So I started to work with museums because that's where kids go to socialize and play. So that's really where it started because my patients could neither socialize nor play typically. And I went to the museums and I said, you know, play is considered a human right by the United Nations, that they were depriving my patients of their human rights. And
Mm-hmm.
that didn't work actually. But what did work was the museum conferences. Yeah, the museum conferences were coming to Philadelphia. So I submitted panels and I said, if you do something, and this was about 15, 16 years ago before autism was really all over the place. It was just starting to come. So that's sort of where I started. And then it kind of evolved organically from there, to the other programs and to healthcare.
I'm just curious about the actual center. Because
Yes.
when you go on the website for Jefferson Medical Center, there are these photos of some of the innovative ways that you are supporting neurodivergent people coming in. Yes.
Yeah, so eventually, that work got more and more consuming, the community work, and it expanded to adults. And we do know that once kids age out of pediatric care, a lot of people with intellectual and developmental challenges actually fall out of healthcare completely.
Mm,
And that's a big problem. It increases their morbidity and mortality. And I was looking for a home for my work because it wasn't sustainable for me personally to support it. Um, and I looked at all the hospitals in the Philadelphia region, and I really wanted to be at Jefferson for a couple of reasons. One is that it's very mission and vision driven to improve lives, do the right thing, be innovative, and to be inclusive. And the other thing is that Jefferson had just taken on a school of design. So it has healthcare schools and it's a healthcare enterprise, but it also had a school of design. And I,
mm,
until that point, had been working on processes, but I really wanted to get my hands on the built environment because that sensory stuff is so critical before even anything happens. And so I was really lucky again, and I made contacts at the university as well as the healthcare center. And now we have multiple university courses integrating community engagement, health, and design. And it's really fun because we get the students to sort of think that way at the very beginning of their careers, to think collaboratively, which is better, I think, anyway, and more fun, and also
mhm.
to be able to directly reach out to different communities when they're conceptualizing or ideating, right? So hopefully this is sort of a cultural shift. And
Mhm.
I was looking for a home and I went to Jefferson and I explained sort of what I wanted to do. I said, I still want to see patients, which are kids, but I want to work on this sort of community engagement program through the lifespan. And they started the center. And everybody on my immediate team is either neurodivergent or has a first degree relative that is, or both.
So important to get those informed, life experienced voices There's no doubt about that. By the way, another connection just came to mind. A previous guest on our podcast, Dr. Robert Nassif, speaks so highly of you, and the work that you do. So
He's great. He's amazing himself. So that's
he is.
flattering.
He teaches us so much about family experience as well as his direct work as a clinical psychologist. So, what does it look like on a daily basis in terms of what you actually do in
Yeah,
this setting?
It looks like chaos. So I usually see patients on Tuesdays and Thursdays, although sometimes other days. And then the rest of the time is a mixture of creating programs, trying to measure outcomes. We have 5 or 6 university courses that will be running at different times. So I either fully teach those, like one, usually of those courses, maybe a year or every other year, but then I lecture and or go to the critiques for the other ones. So, for example, we had one on immersive art, and we create immersive art light-based experiences, and then we measured the outcome of that on neurotypical and neurodivergent individuals. We have one for industrial design where we created a line of furniture for neurodivergent individuals, and we have those at our Honickman Center, the subspecialty care center at Jefferson. We created those with Miller Knoll and through our university courses. And Barry, I just want to say that there's nothing wrong with a sensory room. In fact, it's a great idea. But what is not a great idea is that it's the only idea
Hmm.
and it's separate. And I just felt like there should be other options. And the seating that we created both with people that were speaking and non-speaking, because we had the course and we had different iterations of this chair. And so we brought people in, even that were non-speaking, and we videotaped them and coded their behaviors to gauge their comfort levels with
Mm.
different aspects of the seat as we developed it.
Hmm.
Did you find? Sorry, this is maybe a specific question, but this is fascinating to me because like Barry, I do a lot of public speaking, and inevitably people are asking questions at these events, like, so what can I do in my office space, like for my company, to make things more comfortable for blah blah blah. And I always have a hard time answering that because it's like I don't have a book full of like references and evidence and research. So what I would say is, for my own perspective, keep it at 71 degrees. Don't put me underneath air vent, and I'm good, right? But did you find that there was commonality, like a marked commonality between or among the neurodivergent participants versus the neurotypical participants, where it's like, yeah, for the most part, the neurodivergent people wanted a chair that felt like this, as opposed to the neurotypical folks? How did that shake out?
So this is such a great question. Thank you. And honestly, what we have found when we go back to that building, and now we're starting to watch the use of the furniture and the different amenities in that building, we are finding that it's equally more popular with the neurotypical individuals as well.
Mhm.
And we kind of see it like a ramp was created for wheelchairs, but benefits other people with mobility issues. And so we are finding often more and more again that um, what we're doing for our population is really helping and supporting everyone.
Mhm.
Yes. All right. Done. Check. Bring the check, please. I'm done with this This is like the. I knew it. This validates everything I suspected and have been saying without evidence. And it's wonderful to hear you validating this now with an actual endeavor that is proving that what we do for the neurodivergent individual benefits everyone.
Mhm. Yeah, Wendy, as you were describing that, I'm thinking about, over the years, so many classrooms I've been in, and, more recently, some of the classrooms have these chairs that you can kind of rock in and put backward pressure on, and it gives you sensory feedback without the legs lifting up off the floor or needing an actual rocking chair, and how much more comfortable and, if you will, normalizing it makes it to sit and to rock and get that sensory input that you need in your body. So as you were describing that, I was thinking that even a stiff plexiglass chair versus one that allows that movement can make all the difference in the world for a particular child or a particular student.
Yeah, and I think what you said is a really good point also because it brings home this issue that it's really about belonging. It's about normalizing a little bit. And I talk about inclusion, but inclusion is also like a little bit patronizing, right? It's like I have something and I might let you in. I might
Mhm.
include you. It's sort of like there's somebody that belongs and is opening a door. But we really like to think of it as a more normalizing or belonging type of experience, like you said.
Yes, because everybody benefits from that. So you've been, I'm sure, in the years of your training and your experiences, um, you've seen the need for attention to details such as this, as well as the physical space of even entering a hospital or a medical center. How have things evolved in your opinion? Like, what's the old school way of doing it, and
Yeah.
what are kind of the innovations that are making things, so much more, if you will, less stressful or even less traumatizing? Because we do know the autistic community, for a number of years now, have been saying going to healthcare for many reasons could be one of the most challenging experiences that they have in their lives. But physicians also say that, especially in emergency departments.
Yeah, and one of the great things about Jefferson is about 5 years ago, they started to design their specialty care center. And I went to my boss and I said, I heard this building's being designed. Could we perhaps have input into it? And by that I mean asking our population for, first, not just me coming up with some ideas and then asking later, right? So we had focus groups and I think some of the things that we were able to shift in that building that went from sort of maybe a more traditional standpoint, like you were saying, to maybe a little bit more innovative was we created these semi-enclosed alcoves
Mm,
in the big waiting areas so that people don't feel as exposed or vulnerable. They're not kind of out in the middle of a room. Um, and they have sort of a textured walls. We got to pick the textiles on the walls, on the fabric, on the upholstery, and it gives people a little bit more privacy. I think healthcare is stressful for a lot of people, and
hmm
anything we can do to create a sense of safety is helpful. And we have 9 pieces of immersive light-based art. There's a lot of data about the impact of art on health and well-being, including things like length of hospital stay. So then when you start to talk about
mm.
saving hospitals money, people start to perk up, right? So um,
Yes.
we have immersive art. We have bathrooms where you can control the sound. So, like, you can't make a
Mm,
whole bathroom totally quiet because a flush is a flush, right? But um, there are some of the traditional bathrooms which save money for various reasons, but then there are sound controlled bathrooms that don't have the air blowers. And instead of an automatic flush, you can control the flush, right?
I
We
am
have a
telling you, this is gold. I was going to, well, as soon as we start talking toilets, that's where my ears perk up. Like, I'll let you continue because you're actually a qualified professional and I'm an idiot with a cowboy hat sitting on his printer. But I will say that the bathroom issue, it seems banal by definition, but it's massively important. And in fact, I, for a while, had architected in my mind a pay per use, like a subscription model for environmentally awesome bathrooms. And when I say environmentally awesome, I mean you control exactly what the setting is in there, and it's always clean and things. And what you're obviously, I didn't do anything with it because that's a preposterous business model, but you're hitting it right on the head. Where I travel a lot in the airports and the restrooms, I hear so many dads with kids where everything's going fine. There's a loud flush. There's the janitor comes in, and because it's all reflective surfaces, the janitor's bucket smashes into the wall, and it sounds like a gunshot, and that's when the child starts either panicking and then the dad doesn't expect that to happen. All of a sudden, both of them are now dysregulated, and it becomes a real problem, totally avoidable.
And the hand dryers, the hand
Yes,
dryers.
yes. That for a million reasons shouldn't be in there. Just give me paper. Yeah, please continue. This is music to my ears.
I just want to say it's not really that. I mean, I know I have a medical degree, but it's not that I really think that I have any or all or any of the answers. It's more that I feel like we're asking different questions differently from different people, or maybe more people. So I think all you need to do to be sort of doing this kind of work for anyone who wants to do it is to be sort of curious
Hmm.
and to not give up and to keep asking people if you can try something new and you know, we work on the built environment. We have a school of architecture. We work on interior designs. We have interior design classes. We have an international symposium on the built environment, which is free. It's hybrid. If anybody, I can send you the information for that later. Every year, we have a fashion course, and we're aspiring to actually create a neurodivergent friendly design minor so
Hmm.
that people can come and learn more about this or even just an approach to creating an environment. And I don't think it's a one size fits all. I think,
Hmm.
like everybody else, what, you know, if you know one person, right? So, but I think it's about having flexibility and different options.
Hmm. I've always felt that for so-called neurotypical people, the best way to try to have some entree into the experience of a neurodivergent people is to see how we respond to the sensory environment. And I'm going back to the hand dryers now in the bathroom. It drives me freaking crazy, and the differences in some hand dryers as opposed to others could be dozens of decibels. I mean, it's
Yeah.
loud.
Yes.
It's aversive. I happen to have tinnitus from playing drums for years, and sometimes I walk out of the bathroom and it's my tinnitus is spiking due to that. And it's kind of like, if I'm experiencing this, imagine a person with auditory sensitivities, and the fear and just the basic neurological reaction to that could be totally overwhelming. Just
But
one other quick
also,
point. Go ahead, Dave.
oh, I was just gonna say, and your ears are ringing, and your hands aren't dry. Like now I'm walking through a crazy airport with wet hands, like a savage. It's unreal. We have to fix this. But Barry, continue.
Yeah, I was going to say I would be remiss if I didn't acknowledge a previous guest's work, who's an architect, Magda Mustafa at University of Cairo, and some of the things that have been implemented at Jefferson just remind me of some of the things that she said needs to be done, and she helps from an architectural perspective
Yep.
designing some of that as well.
Yeah, I know Magda very well. She usually speaks at our international symposium
There you
every
go.
year.
Yeah.
And we have a mutual friend in Adam Harris at As I Am in Dublin, you know, and they worked on that University of Dublin together.
Yes.
And there's several accommodations there, including some like sensory pods where people can take an escape or quiet areas. Magda's great. And I think there are a lot of other people. I work a lot with Rachel Updegrove, who's an autistic architect. She
Ah.
designs labs and she has some amazing perspectives too that are really valuable.
Yes. So I mean, there are so many factors that can be dysregulating, and we know that dysregulation is cumulative. So going into a medical setting and having these protective, I don't want to say protective, but these pods that actually support regulation kind of mitigates against the stress of going into a medical setting. But you do other things. For example, on the website for the center, I noticed that you have a lot of information to prepare families and neurodivergent individuals. So why is that important? As I think it's helpful to everybody to reduce uncertainty and to know what's going to happen, but particularly important for the patients that are coming in to your setting and similar settings.
Yeah, I mean, I think to your point, it has to be multi-directional, right? It's the built environment, it's preparing the individuals and it's preparing the people in the setting, all of it. And we prepare the individuals because often when you know what to expect, it decreases your anxiety, right? And when you think about things like Carol Gray's social stories or visual schedules, how we know that they support this population, right? So we have just begun to apply them in, more and different areas. And they have been extremely helpful. And again, they help neurotypical people too, because sometimes you don't know what's going to happen if you're getting like your first colonoscopy, right? Like you have a general idea, but you don't know what's going to happen or what's expected of you aside that you need to sort of do a clean out, right? But and sometimes when you know what to expect, it decreases your anxiety. And of course, when we're anxious, things in the built environment can make us feel even worse, right?
Hmm.
So there's a huge interplay between our sensory systems and our anxiety. Like if I'm driving in the car and my kids are being noisy in the back seat and the road is clear, it might not bother me. But if I'm in the same situation with my kids in the back, but now the roads are icy, now that noise, I'm not tolerating it, right? Like it's not
Yes.
that they got louder. So we need to work on all of these things, sort of the environment and sort of trying to reduce the anxiety and prepare people. And then the last piece of that is that the people in the community need to be sensitive, aware, and to have strategies and tools in their tool belts too. Like it seems to me that if somebody put somebody in a wheelchair and there were no ramps or curb cutouts, people would understand that that doesn't work. But
Hmm.
for some reason, for people with invisible or neurocognitive or autistic features, it's sort of like, oh, you're on your own. Like we don't have to do anything, and that's really not the case. It's not, and the community does have to meet people, and it's not just for patients, but we also did a study with Mary Doherty from Autistic Doctors International because there's autistic doctors out there that are not able to access their jobs because their colleagues are not understanding. There's a stigma, they don't disclose, they don't, so this is such a complicated, multidimensional issue, I guess.
Yes, and Mary was also one of our previous guests. So we're all on the same page with the same great people that we're learning from and including in our collaborative efforts. Just so important. And thank you for really emphasizing the cumulative impact of dysregulation, because I think as the whole notion of physiological and emotional regulation has gotten so much more attention over the last couple of decades, we still have a very static view, like what's the trigger and why is this person so dysregulated, as opposed to things that happen much earlier in the day or even in the week or even the month before, or as you said, the environments as well as what's going to happen in the environments as well as a person's perception. As Dave likes to say, their mental model of what I expect when I go into a hospital setting. But the fact that you've developed this awareness and the impacts in a medical setting, it's so important. And let me just throw in there, for those parents who are not fortunate enough to have access to a setting such as Jefferson Medical Center, it's okay to ask lots of questions about what's going to happen and what to expect. Because not only does it decrease the anxiety for the parents, but also for their family members who might be neurodivergent. So we're also talking and touching upon the issue of mental health right now. And so I'm curious, because you've had experience, and in particular with one young man who we both have gotten to know, and without going into specifics there, in just following the journeys of families and neurodivergent people. So what's your experience as a physician in watching people navigate through their journeys, both kind of protective factors around mental health as well as risk factors that may contribute to mental health difficulties?
And again, I think I'm so glad that you brought this up because I think this comes back to something so important in healthcare, which is sort of revisiting the importance of empathy. And I think there's not enough empathy. Like, I think healthcare has become so rushed and so driven by data that a lot of new doctors, and we're working on this at our healthcare center too, we're training our medical students. We have medical students that have an early acceptance program if they have studied autism, actually. to our medical school to change the culture from the ground up.
Hmm.
And again, this is not a skill that's not needed by every doctor, but you need a little bit more of it for our population, right? But so to like what Dave was saying, it's just sort of like we all benefit, but it's about the care that some people have to have, but that we all kind of deserve. And it's about how we approach, like sometimes you go into a room and there might be a caregiver or a family member, and the tendency is to not let them contribute, um, or to ignore them. And sometimes I'm not saying there's not a rare occurrence where there's some kind of overly pushy family member. I'm not saying that, but you got to read the situation and understand that sometimes a family member knows their person, right? And they should be incorporated appropriately into the care as the patient allows, right? So when we go into a room, we need to do whole body listening. We need to not be just looking at our computers and typing a note, right? We need to not just be looking at labs. We need to be truly engaging with the people in front of us, and we need to meet them where they are.
Hmm.
And this comes up again and again, and it's about how you also, as a clinician, need to make your patient feel comfortable. And that happens with how you interact with them and having tools in your tool belt and having enough empathy and making time to communicate with them in a way that they can communicate with you
Hmm.
and to understand them on a level that you can more accurately meet their medical and healthcare needs and goals.
Yes, and it's very difficult for the healthcare professional these days in the United States anyway, because the model is if you can see 12 patients today, then you could probably see 18 and we can get that extra 6 patients worth of billing. So speed it up, folks. Like let's crank the sick people through here.
Yeah.
As opposed to let's take the time we need to sit down and say like, I wonder if there's some underlying thing that we haven't considered yet.
Mm.
Yeah, and I think, when I presented at Becker's like conference for healthcare, and I think when you start to show that bad care is actually more expensive, like if bad care costs less, people sadly sometimes accept it, but
Of course.
but but I think, what I was able to show is that for this population, if they got better primary care, it actually is not just better for them and for you in terms of your outcome measures as an institution, but it actually does cost less because
Hmm.
now they're not using the ER as their primary source of healthcare, which is more expensive, right? And then, you're catching their cancer, let's say earlier when it's easier to treat and less expensive. So I think it takes like a lot of holistic conversations to get people, to where we really want them to be in terms of the care that people need.
Yeah. And isn't it sad that we find almost that it's the exception when we go in for medical care, regardless of what the specialty is or there's primary care, and we say, "Oh my goodness, that doctor was so empathic, and I really trust this person." And we're surprised, as opposed to it being something that is expected. And a few years ago, I attended a conference that was developed by autistic people, Stephen Shore, Dr. Stephen Shore in particular, around medical services, and how many people, especially autistic women, spoke about the fact that they hesitate going in for health care because they've been not believed so often when they report whether it be particular ailments or concerns about their health. So there's that, what we refer to as that emotional memory piece. Well, why should I go back there if it's stressful or if people give me messages that, well, I'm really not hearing you or listening to you or believing you.
Happens for a lot of women in general. I mean, that's why female heart attacks are missed. And that's why, but we actually do have a primary focus on women and girls. And I work a lot, and I'm sure you know her too, with Jennifer Cook, who's amazing.
Yes.
And we've become really good friends. And, I've even, I find it's coming more and more into popular culture. So recently, before it aired, I was invited to consult with the show The Pit with Noah Wiley.
Hmm.
And on that show, there's an autistic doctor, a female storyline, and she has an autistic sister. And, we talked a lot about those things, how girls and women present more subtly.
Hmm.
She may not know she has a diagnosis. She might mask, right? And then she might disappear and stim for a little bit. and how we would incorporate that without the stereotype savant sort of storyline, and how
Hmm.
this character potentially would have a better understanding of an autistic patient and things like that, and how I feel like the more we're going to see this in popular culture, how impactful that is on everything else, because it
Hmm.
makes it sexy, right? So
That's right. And sometimes people need kind of it being presented in a very, very engaging, even if it is fictional, in a very
mhm.
engaging way to hold on to those memories, and that's so important. Uh, so, what have you learned by following the journeys of so many families that you've worked with over the years and have followed, and also that especially vis-a-vis the changes in healthcare. But what do you take away uh, for you personally and professionally from the families whose journeys you've kind of followed over the years?
I think I was always kind of humble, but I think I approach it more and more with a sense of even greater humility and curiosity, because a lot of times we make assumptions, and I think that's one of the core tenets that we have, is we always ask first. We never just do something and then ask people to come in later, because often then it's too late, and then
Hmm.
information is kind of guided to where you want it, right? Like the outcomes. So we always try to really engage caregivers, individuals from all different backgrounds and ages, all different levels of cognition as best we can, or communication, to really try to understand, are we doing the right thing? Are we doing the best that we can?
Hmm. Which, in part, is the definition of reflective practice, isn't it? Let's think about what we're doing, and let's understand that we're lifelong learners ourselves, as people who are supporting neurodivergent people and their families, and I mean that just comes through in everything you've said. When you use the word curiosity, I mean that means I have a lot more to learn, and it would be wonderful if there was a lot more of that in supporting autistic and neurodivergent people.
Yeah. I mean, I think it's important to presume competence. And I think that's not just in the population. I think there are a lot of doctors and professionals in the world who also want to be engaged at this level. Like, I think
Hmm.
when I was doing the air travel program, for example, and doing trainings for TSA, I thought, oh, like this is going to be a nuisance for people, maybe. It's going to be one more thing they have to do or expected to do. And what I found was really the opposite, that everybody wants to make the world a better place. Like most people love the idea of supporting somebody to exceed expectations, especially their own.
Hmm.
And so I think there's a lot. I had pilots that would fly across the country to go to these airport practices, like on their own time, because they were so excited to participate. So I think it's also not to assume that people don't want to engage, because I think people today are looking for a reason to feel good about the world that we're in and to do
Hmm.
good. And if there's a way they can incorporate that in their day-to-day lives and help create belonging or inclusion, I think people want to do it. I do.
That's beautifully stated. And it's just so important, for all of our listeners, whether they be parents, professionals, autistic, neurodivergent people, to really take that in. I think a lot of people, this phrase has come up many times on our podcast. They don't know what they don't know, but when they hear about what they don't know and they know it will be helpful to other human beings, it's kind of like, yeah, why wouldn't I embrace that? Why wouldn't I step forward and listen and learn and change? So important.
Yeah, and I feel that a lot at Jefferson. Like, no entity or healthcare place is perfect, but I feel like, I mean, as you mentioned, have been at many hospitals and healthcare centers, and this Jefferson really, I feel, operates from a place of great heart and really wanting to, do the right thing, be inclusive, be innovative. The opportunities I've gotten there. I mean, when I asked to consult on that building and to bring in my population, the immediate answer was like, okay. I mean, that's pretty amazing. It's a corporation. You know what I mean? So,
Yes.
um, and I was allowed to spend some of my time doing that. So I feel, it's out there. I think there's a lot of good out there.
Yes.
Right. And having access to how they can take that intrinsic motivation or that spark of inspiration to want to help. Now, more than ever before, there's access. So I'm not as familiar with your clinic, but I know that there are models out there where it's like, yes, we have a physical sort of footprint geographically somewhere in the country or in the world. But then we also have maybe like an online community or a virtual presence as well. Is that part of it, or do you feel like the virtual thing is maybe a little overstated in its benefit?
Well, I think, we do try to elicit opinions as far as we can. We're a small group and we don't have a lot of funding. In terms of the virtual world, we do help work with our telehealth doctors as well to help train them. Um, we try to reach as many different kinds of clinicians across our enterprise, and we're sort of doing it specialty by specialty to create that model where we prepare the clinicians, we prepare, Barry, as you were saying, the visual stories and things like that. And then we provide also other things like sensory bags and seating and environments. And we try to do that. We also sometimes get people approach us from other areas. So Pennsylvania Supreme Court Justice Dougherty wanted to make the courts more autism friendly, the family courts. And so then we were invited to bring our model there. So sometimes, more and more people hear about what we're doing and they engage with us to help spread this kind of a model.
That's that, for lack of a better term, that evangelization of the philosophy of your center and the actual like body of the work of your center. That's such a great way to get it out into the world. That's fantastic.
And it's an exciting time. I mean, we're in the middle of all of this. And if you look back and just reflect on a decade or two ago, things were very dramatically different. We have a lot more work to do. There's no doubt about that. But we're heading in the right direction. And Wendy, it sounds like so much of what you've done and what's happening at Jefferson is an example of that. So thank you so much. I think this has been a wonderful discussion, kind of like from the inside out, from a professional who every day is in a healthcare setting and has done really innovative things with your collaborators and making those changes. So that's so important.
Well, thank you so much for having me.
Yeah, it is absolutely our pleasure.